and what is to come in the future. Please introduce yourself, Dr. Benoit.
Hi, good evening, everybody. I'm not any stranger for the Facebook family. My name is Dr. Marcel Benoit. I'm a practicing physician in the community. I'm an internist and also I'm a nephrologist. So I've been also an educator for all my career, educating the people. Plus, I've educated many medical students. Now I've become attending. Well, I've become also nephrologist uh, uh, as I am. So I'm glad to be here. So I'm gonna try to bring some awareness about the disease tonight.
Okay, Dr. Benoit, I have some questions for you.
Yeah.
First of all, can you give us an understanding what exactly is COVID-19?
Okay. The COVID-19 is a name that is the name of the virus is not COVID-19. The name of the virus is SARS-CoV-2. Now, it's a family of the coronavirus, which has about seven strains. There are four major strains that are very common in the United States, and they also responsible for a lot of flu symptoms during the flu season. Now, and then we have SARS, and then we have MERS, and then now we have COVID SARS-CoV-2. There's SARS-CoV-1 and SARS-CoV-2. This is COVID-2. Now, SARS-CoV-1 was happened in China. At that time, there were 800 people die, and MERS was noticed in the Middle East, in Saudi Arabia, where it kills about 700 people. And now we have SARS-CoV-2. They changed the name in February 11th by WHO, give it a COVID-19 due to the presence of the respiratory problem that we see in COVID-19. So the name of the virus is not COVID-19. It's SARS-CoV-2.
Mm. So how does that come about that it gets called COVID-19 then? Is that for the layman to
No, no,
make?
that's a layman. It's a coronary virus.
Okay.
Right? It's a coronary virus. So it's that's the abbreviation for the whole family.
Now, what are your thoughts regarding the use
All right.
of
That's good.
Oh, sorry. Oh,
Yeah,
sorry.
good. Yeah.
What is your thought regarding the use of ventilators? Is that the best path to go in reference to treating the respiratory ailment of it?
Okay. So this is a major issue that the medical community is facing with. Now, I think to understand really the pathology of the disease, you have to understand what's going on when somebody has coronary virus. Now, the entry of the virus is within the nares, the natural, where we have receptors called H2 receptors, where the spike protein of the virus binds with those receptors, goes into our nostril. That's what they tell you: do not touch your face, do not touch your nose. And then from there, the virus gets its entry in the respiratory tract and then gets into the lungs. Now, whenever somebody has a foreign object or in your body tends to respond to it, and it causes a a a release of an inflammatory response. The inflammatory response, usually the presence of lymphocyte, B lymphocyte, which produce antibodies, and also T cell, T lymphocyte that cause the that amplifies the effect of the B lymphocyte. And then you have a
Mm-hmm.
surge of a whole cascade of inflammatory cells, not probably cell elements called the cytokines and the interferon and the interleukin. So what the physiology of coronavirus is that there is a super inflammation, or
Mm-hmm.
there's a hyper inflammation more than usual, and that inflammation destroy the lining of the lungs. Hence, that superinflammation destroy the lungs completely, and the person becomes hypoxic, low oxygen. So
Mm-hmm.
when you become very hypoxic and you can breathe on your own, the only recourse that you have is to put you on a respirator. Now, it is alarming because many people have died on the ventilators.
Mm-hmm.
At least 80% of the people who were placed on the ventilators died. So the medical community is questioning now, are there any other avenues to combat the disease? So and there are a lot of other type of treatment on the way or in process to see whether or not we can attack the virus from another side.
Now, what is the process of, I don't know if the correct terminology is having a ventilator inserted. Is that what they do? They insert a ventilator?
No, no. They first of all they will put a tube down your tube pipe, all right,
Mm-hmm.
and that's usually to your trachea, and then it gets to the main bronchus, and then that it stays right there, and then they plug the machine onto you. Now it depends of the level of consciousness of the patient. If the patient is completely out, the machine does all the breathing for the person. If the person is semi-conscious, the person will trigger a will trigger the machine, and the machine will complete the respiration for the patient.
Okay. 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 Now, I have another question. Let's say there's a scenario where a family member has not left the house, they're in total quarantine for about a month or over a month, but then they still test positive for the COVID 19. So, in a situation like that, how do you think it's transmitted
Well,
if they're in quarantine, but
but
they still come up positive?
there's somebody in the house who is asymptomatic, who has been asymptomatic, that has transmitted the virus to the other family members. Somebody, they may have a visitor who came in asymptomatic. Somebody came to the house, um, 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 or they came in contact with somebody who was positive, but not knowing he or she was positive.
Okay. Now, asymptomatic is when you're positive, when you would test positive, but you don't have any symptoms,
No,
correct?
no, asymptomatic. Now, right now, there's a big difference. Now, a recent study had shown that people who are pre-symptomatic, that means that before they have any symptoms, they are more infectious
Mm-hmm.
than somebody who is symptomatic, who has symptoms. Okay. Now, asymptomatic means that a
Pre.
person pre-symptomatic, before you have symptoms. So there's asymptomatic, there's
Okay.
pre-symptomatic, then they're symptomatic. Okay? So asymptomatic, you don't
Now,
have any
the
symptoms.
person's pre-symptomatic,
Now,
but
now,
you would still test positive.
yeah, no, no. Well, let me tell you. Okay, to show you the complexity of the virus, so they look at patient. They are patient who are asymptomatic. That means they don't have anything whatsoever. They still can be positive.
Mm-hmm.
30% of these people, they're between the age of 30 and 49. Okay. Now they are patients who are pre-symptomatic before they have symptoms. All right. They shed a lot of viruses. They are more infectious than a person who is symptomatic. You understand?
Okay.
So before
And
you,
I can kind of get it
yeah, yeah, before you
because
become,
it's potent. Is that
yes, exactly, yes, yeah. So when you symptom, so that means that we have to consider everybody to be COVID positive because lots of us are
mm,
asymptomatic and lots of us do not know
oh my goodness.
if we are infectious. So that's why measures of social distancing are paramount to curb down the disease.
Okay. Wow, that's a scary scenario.
Yeah, it
That's a
is. So
scary scenario.
yeah, uh-huh.
Now, pathway disease. Why is a respiratory disease causing brain inflammation, kidney injury, and conjunctivitis,
Okay, good question. Now, a
which,
while ago
which
we
is
were
something
talking
I
about,
only learned
okay, a while ago
about.
we talk about the virus. Now they understand the virus causing a hyperinflammation in that's layman terms,
Hmm.
but in technical term there's what's
Okay.
called a cytokine storm. That means that the cytokines are inflammatory cells. they, there's a storm, there's a lot of cytokines liberated into the body, mostly in the lungs, in the
Hmm.
brain, in the liver, in the kidney. So those cytokines, usually the cytokines, you will attack foreign foreign objects. The cytokines now they attack healthy cells. If you destroy a healthy cell, you're gonna destroy the functionality of an organ. So that's why um, 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 COVID-19 has causes so many damages. Now, in terms of clots, yes, they found that many people with COVID-19 they may present with initial stroke, with seizures, with heart attack, with renal failure. It's because that they tend to form clots. Why? Because that they found out most of these patients they have the presence of a substance called antiphospholipid B.
Hmm.
So those this substance it proliferates into the blood vessels and make the blood very thick. That's why patients who are not admitted to the hospital, they will check um, the level of D dimers. The D dimers are is a substance produced by the clots. So once your D dimer is high, it means that you tend to form clots, and it is a bad prognosis for death. In addition, they also check the level of your inflammatory response by
Hmm.
checking the blood level for C-reactive protein, erythrocytes, sedimation rate, which is called ESR, procalcitonin, ferritin. These are all markers for inflammatory response. So yes, patients with COVID-19 they are at risk for blood clots because of what just explained to you. They have presence of antiphospholipid B, and then you have clots all over.
Now, in your opinion, what do you think would be a criteria for an essential worker to return to work? How should that be determined?
Very good. So let me tell you the model of the Chinese, and the Chinese are pretty successful. And I think that if you really care to go back to normal to normal to no, a normality, I think we should follow the Chinese guidelines. This is the way Chinese does it. Once you become COVID positive, you stay 2 weeks in quarantine.
Mm-hmm.
2 weeks, and then you stay another 2 extra week at home, and the following week you go back to be tested, and you tested within 22 tests within 24 hours. If you're negative, then you're okay. Now, for the United States and the CDC, I don't understand the CDC. The CDC gives you some guidelines that are crazy. They tell you if you are COVID positive and after 3 days you have no symptoms, you can go back to work and then wear your mask for 14 days. Why the hell do you want the 14 days if you think the patient is okay? All right? They say if you have no fever after 3 days, you can go back to work, but you have to wear your mask out of work for 14 days. But if you think that I'm okay, why you send me back? Why you ask me to wear my mask for 14 days?
It's playing Russian roulette.
Exactly. So what the study have shown that even after even after your symptoms are gone, you still can shed the virus. And they have noted 39 days later, they see the virus in feces in patients who were positive, and 13 days in sputum. So the patient in the United States who are tested COVID positive, they send them back to work. That person is going to affect more people. So the guideline of the CDC is totally irrational. It doesn't make sense at all. It makes the infection you will not curb down the infection. Now, so I would prefer to go with the guideline of the Chinese.
Okay.
2 weeks quarantine, 2 extra weeks at home, and then the last week you go back and get yourself tested.
Now, coronavirus, is it passed through large droplets? Is it an aerosol? How can it be transmitted? How is it transmitted exactly? Is it transmitted by speaking, by touching, physical contact?
Yeah. When you talk to somebody, like you said somebody like 2-3 feet away, whatever comes in your mouth, they are called droplets. Okay. Once the droplets deposit.
Wait, I can't hear you. Maybe
it becomes actualized. So that's why they told you that you can catch it in the air because aerolized. Now the aerolized component of this is very small. It's very small, about 5 microns. You cannot see it with naked eyes. You cannot see it with naked eyes. So that's why they ask everybody to wear a mask. So based on this study, the first wave of transmission is through respiratory droplets. That's the most common, and the second is this aerolized component. when they say it's airborne doesn't mean that it's in the air. Okay, airborne, that means that once your droplets get in the air, you can catch it, but it's not in the air. It's not. We go outside, you breathe and it's in the air. And all right. So people
Now,
understand that it's airborne. It's airborne. It's in the
now,
air. That means that the air is full of COVID. Now.
so let me understand. So that means when I'm speaking to you, if I sneeze, if I cough,
Yes.
it can be transmitted that way.
Exactly. And then whatever droplets you emit becomes aerolized in the air. And if you breathe the same air with a person in a confined area, then then you can catch it. But it's not going outside and then you breathe the air, it's in the air. That's what people understand. It's not like that. Yeah.
Now the touching aspect. So is it if I touch as you said, if I touch my nose, if I touch my mouth, then I can transmit it through my hands?
Exactly. Yeah. That's why they ask you to wash your hands for 20 seconds and make sure you don't touch your face because you can easily catch the virus easily this way.
Okay. Now, can a person catch it twice?
Yes. Now, and that's worrisome because somebody after 3 days you become asymptomatic and then you go back to work, you may not have time to develop any antibodies, no protection whatsoever, and you go back to work and then you can catch the infection again. And I think the second infection can be even worse than the first one.
Because your immune system is not compromised.
Exactly. Your immune system is not ready yet to respond to it.
Now, so if a person is able to catch it twice, why are they asking those? And why are they asking for someone who recovered from COVID to donate their blood and such?
No, okay. There are people
Mm-hmm.
who were COVID positive and they have recovered and then they develop an immune response to the COVID, then they have antibodies. Now, supposedly, those who have antibodies, they now they have an immunity against COVID, and by using their plasma, those antibodies will serve as memory cells and fight the infection.
So are there certain characteristics in who the person that develops its bodies? Are you finding that it's someone who's healthy, someone who
usually healthy people? Yeah.
Okay.
And that's why you see a lot of although we have a lot of few young people die, but for the most part, most young people go through the infection with no problem because they able to mount and a response against the virus, and they're okay. On the contrary, the most vulnerable people, the elderly, the people with underlying diseases, most of them cannot mount an immune response against the virus, and then they succumb.
Now, what have you learned or what have you realized personally from this pandemic in regards to the medical community as it relates to society, work, politics, the economy? How does all of that come into play with the medical professionals' desire to heal someone? But yet society is telling the medical professionals, we have to open up the economy. We have to go back to work.
Okay, but I think one thing that this disease, this infection has unveiled with better clarity is that structural racism is is there, is vivid, it's palpable, because as you can see, more Hispanics and blacks are more affected with the disease. And when they look at the zip codes of people living in New York, people living in the with the poorest zip codes, they are more affected to the disease. So I think that it gives you another affirmation that structural racism is there and nothing has changed really. Nothing. Right? The same thing we've been fighting 50 years ago, they're still there. That's one.
Okay, so
Now,
help me to understand the connection between the racism and the victims or the of the disease.
well,
I don't assume.
okay. The reason being is that because of structural racisms, a lot of blacks for many years, they have not get, they have not they're not getting the access to healthcare as their white counterparts,
Hmm.
and they don't do preventive medicine because they don't have the means. So therefore, a lot of blacks, you will see them. A lot of them are hypertensive, and they never take any medication. They never see a doctor, and they have a stroke. A lot of blacks, they 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 don't follow any nutrition model. They will eat any kind of food, a lot of rice, a lot of bread, a lot of fried foods, and they become obese and they become diabetics. And they never have anybody to talk to them what to eat and what not to eat. A lot of blacks also, the fact they don't take care of themselves properly due to lack of access to healthcare, a lot of them end up to be on dialysis. They have a heart attacks, blah blah blah. So due to the fact that blacks do not get access to healthcare as easily as whites, a lot of diseases are not being monitored, and then they take a toll on your body. When you have hypertension, diabetes, all those things, they take a toll on your body and they decrease your immune system. So if you face with the virus that use your body to replicate, to make up more viral particles, it's going to take a toll on you. So that's why many blacks are at risk. But not only for the physiological aspect, but from a social aspect, blacks and Hispanic are into a more vulnerable condition. With a lot of blacks, they live in dense areas, dense areas where people they live in projects, they live in a very dense areas. So being living in a dense area, as you can see in New York, is the epicenter of COVID. So a lot of them gonna be infected, gonna be infected.
What can the population be doing better? Is social distancing the answer? Washing your hands? What can we as laymen and as a society be doing to combat this disease, this virus?
I think the social distancing has really proven by all means the best way to combat this virus. Because if we did not practice social distancing, the you would have seen a a higher a higher incidence of fatalities in New York. The fact that the governor closed down everything and till May 15, that's the reason why you don't see more cases. They were predicting, they were based on certain models. they were predicting million of deaths, million of deaths.
Mm-hmm.
Now they're talking about 60,000 deaths. So although it's enormous,
In
but
comparison, it's small, but in reality, wow.
exactly. So social distancing works, and not only that it works, you can see now based on the numbers coming now. You have based in New York, precisely, in Italy, in Spain, because Italy is completely locked down, in Spain completely locked down, and China had a lockdown for 76 days, only lockdown, and then now they're coming back out now. So in New York, in Italy, especially in New York, you can see the number of hospitalization, the number of ICU admission are coming down, meaning that it's social distancing. There's no therapy, absolutely nothing out there, no treatment so far for COVID-19, nothing whatsoever. So, it's all we have now is confinement and social distancing.
Can you dispel some of the myths, 5G towers, uh, the initiative to have everyone vaccinated, a man made vaccination, and how does a respiratory disease multiply and reciprocate similar to HIV? I know I asked you a lot of questions, but
Well. All viruses, they use your genome, your own body, to replicate. All viruses, and the same thing for HIV. They use one chain. If the virus is a DNA virus, they'll use one chain of your DNA, one chain of a DNA virus, and replicate. If it's an RNA virus, same thing. So HIV, COVID, all the viruses, they use your own body to replicate, and they will, and if your body is not strong, they'll make many viral particles until they overtake your body. Now, as for the 5G stuff, there's nothing concrete about that. It's all stipulation. Um, at first, the origin of the coronavirus was thought to be from animals, primarily camels and bats. Now they're questioning the validity of the origin of the virus. So we see what happened. But the 5G thing is just making big. It's just making news. But there's nothing valid about it. It's not proven.
now we know that there are certain states that are pushing to have the cities and the states reopened. And a lot of minorities are feeling that it's another way to attack the minority community and to take them down just to benefit the economy. Now, you just said that you're a fan of a complete lockdown. What message would you give to the residents of those states and those communities that their political leaders are pushing them to go back into society?
Now, let me tell you, before I answer your question, let me tell you there are two places in Europe where they were a little bit lax to implement social distancing and confinement. And now they have so many cases. Great Britain, right? They were very resilient to practice social distancing. Now they have 100,000 cases in Great Britain, and that they have also lots of deaths, right? Sweden, same thing. So now, and all scientists have said that if we prematurely reopen the economy, you're gonna see you're gonna see have more deaths. So what I would advise my black folks, whom gonna be probably the number one victim, because 45% of the essential workers in this country are immigrants. They are blacks, they are Hispanics. And once they're whipping the economy, they're gonna have to go back to work. And no, well, I can say that they're already going, they're already working already, but most of them gonna go back to work completely because the essential worker never stopped working. Now, so what I advise them is to be very cautious. They have to make sure that they wear their masks all the time. They have to make sure they practice hygiene all the time, because you cannot tell an essential worker not to go back to work if that person is ordered to go back to work, because that person depends on that earning to survive. Now, the states that are eager to reopen the economy, you will see that in 2 weeks. Sabine, you're gonna call me back. You're gonna say, "Wow, there's gonna be a major surge of COVID-19 in all those states." We're talking about Florida. We're talking about Georgia. We're talking about a lot of the states who are eager to open their economy. They do it now. If in Georgia, they won't even open a gym. They won't even spa where you do tattoos. That's crazy, huh? When you're doing a tattoo for somebody, you can't stay 6 feet away.
Yeah, and
That's
then
crazy.
blood, fluids. That's crazy.
Exactly. So all those places,
Negligent.
exactly. If all those places, all those states, in Florida, you see people, they flock into the beach with no question of social distancing. You see in Texas, they had a rally. People say, "Oh, we open the economy," and people were scattered all around with no mask, no whatsoever. In Michigan, the same thing. You're gonna see in 2 weeks. You'll be surprised. You're gonna see an escalation of number of cases in all those states.
Now, you're not a psychiatrist, but you
Yeah.
are an intelligent man. You're an educated scientist. Is it a defect? I mean, I feel as if many of these people that are in that are following and promoting going back into society, a lot of them are being influenced by politics and politicians. Why are I can't understand how they can promote something that's going to kill them. I can't grasp that mentally when you hear people saying it's a myth. This disease is a myth. I want to go shopping. I want to go to work. I want to do my nails. When there are numbers that are proving that is not a myth. Is that I mean, mentally, I just can't grasp that.
Well, when those people don't they're blind, and the idiocy that they are cultivating, it's mind-boggling. It's somebody has to be retarded, mentally retarded. You look at the data, you see this country as going going is going to have very soon 900,000 of cases, 45,000 deaths. For you to say that it's a hoax, it's a myth. Now, and what is sad about this infection is that it is being politicized between uh, Republicans, between Democrats, between conservative, between liberals, and at the end of the day, you know who's going to lose? Black folks and Hispanics. That's it.
All right, well, I have two, you can say two more questions for you that I would like. One is once a person feels and this is, I'm just phrasing the question, but I would like you to answer it however you would like. Once a person believes that they have COVID-19, can you tell me what are the steps? You feel that you may have COVID-19. What do you do? Then once you have COVID-19, because again, there's so much talk about medication, taking a pill. But I know personally a few people that recovered and they did not take any medication. So I feel as if a lot of people are going to panic and self-medicate. So what is the steps if you feel that you have been infected?
Okay. So um yeah, let me give the audience a few symptoms that you're gonna may have. You're gonna have, you may lose your sense of smell. Okay. You may have fever, chills, weakness, body aches, and at the beginning. Now, and what prompts a lot of people to go to the hospital is a fever. They may
Mhm.
have a fever of 100.7, on 8. They feel very hot,
High?
and then, huh?
That high?
Yes, and they rush to go to the hospital. And once they go to the hospital, they'll do an X-ray for them, and they'll tell them your X-ray is normal. You go back to you're back home. Now, and people don't like that sometimes. They like to be admitted, but you remember that at the beginning of the pandemic, they were fighting against hospital beds. They were taking only people who are really sick. So if you're a person who whom your X-ray is normal, you go back home and you take care of yourself by taking some Tylenol. You make sure that you drink a lot of fluid.
Hmm.
And for the Caribbean people, for the Haitian people, do your home remedy. Okay.
Well, then, for those that are not, perhaps we should share some home remedies then.
I don't want to advocate because I don't know much about that. Because the reason
Okay.
I'm saying that, because since there's no therapy there's no treatment for COVID-19 yet. So we know that, I mean, anybody who's come from the Caribbean, we know that our parents used to give us tea, blah, 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 blah. And sometimes that works, sometimes it doesn't work. So
Mhm.
I would advise all my Caribbean even though a lot of African American come from the South, they use a lot of natural medicine. So if you can do your natural medicine, do it now. And you stay home and you quarantine yourself. Now, if you become short of breath at home, you have what you call conversational dyspnea. That means that you cannot talk, you cannot breathe while talking. You have to stop. That means that you ought to go to the emergency room again. And at that time, your X-ray may get worse because your X-ray may be normal at the beginning, and then it changes along the way.
Okay.
So if your X-ray is if you feel like you're short of breath, you must go to the hospital. Now, and there is a misnomer, a misconception about our people. They're afraid to go to the hospital because they said that once I go to the hospital, I'm going to die because they're going to put me on a ventilator and I'm going to die. Now, remember, it is true. 80% of people die on the ventilator, but there's 20% who survive. 20%. So you may be one of the lucky person who goes to the hospital, and then they put you on a ventilator, and without the ventilator you'd have died, and then you survive.
Can a person not agree to go on a ventilator?
Yes.
And then is it time to go home or will the hospital keep you?
Now, if your oxygenation is very bad, and they offer you ventilator, you don't want it, then you choose that you want to die. You will die.
Oh wow. Okay, so what are the next steps? So where do we go from here?
Well, I think that the next step, the only way for us to go back to normality is two ways. We got to find a treatment. We got to find an antiviral medication that can that can that can kill the virus. And two, we need a vaccine. So the vaccine would not happen now. It would happen into next year, but we need an antiviral medication ASAP. ASAP. Once we have once we have antiviral medication, and then so we be more comfortable to move around, knowing that once we test, and also testing. So once you tested, you're positive, you know that you got to take medication, and then that's it. Yeah. So testing is paramount. Once you know you're tested, you're positive, and once you know you're positive, you have a medication. You take your medication, and then you're okay.
Okay. Thank you so much. I will probably invite you back
Okay.
perhaps in a few weeks as we have more developments because I think it's very important that as laymen that we are able to work through all of the social media posts, various what our friends are telling us, rumors, myths. I think it's very important that we attack it. Sebastian, stop it. I'm sorry, guys.
Mm,
I think it's very important that we attack it from a place of knowledge because I truly believe that knowledge is power. You know, it's natural to have anxiety, but we also have to educate ourselves so that we can battle the anxiety with knowledge and rational thinking. Because I know that uh, I have anxiety on and off around this,
yeah.
you know. And it's like in a sense quarantine is it's an avoidance that's necessary, but it's almost as if quarantine is avoiding what's going on out there. So
Hmm.
you're in your home in quarantine, you're avoiding it physically, but social media and friends and everyone else is bringing to you what you're avoiding, which kind of leads to the anxiety, I
Yeah.
feel.
But I think that um, it's better to have it's better to have anxiety come to your door instead of death come to your door.
Okay. And we'll
Because
end on that.
yeah, because I think people do not realize that by being confined, by respecting the social distancing recommendation, you save your life and you save other lives. So I think that we have to we adapt ourselves, that life will never be the same. Life will never be the same the way you used to know. And so we have to that's what they talk about the new normal. So we're gonna have to change our ways. We're gonna have to be more careful, and our social interaction may change a lot, and then we'll see what happens. But I think that for my community, I would advise all of you to respect the social distancing. Now, I know a lot of black folks gonna gonna have you there guards down once the economy is reopened. When the economy is reopened, doesn't mean the virus is gone. The virus is there. The virus is there. So you gotta respect that. You have to make sure wear your mask, carry your mask. If you are if you are a person who use the the public transportation like a bus, train, make sure you go down, you carry your mask with you at all times.
Thank you so much for that, Dr. Benoit. I
You're welcome.
appreciate your patience and I appreciate your sharing your wisdom with us. And I truly respect your input because when you're speaking as a scientist, you're speaking as a medical professional, and you're also speaking as a minority. I know
Yes.
that you always represent your Black minorities, your immigrants, and this is why I think for our community, your opinion is very important and truly valued. So thank you so much for joining us tonight on Talk About It with Sabine French. As I said, I would love to have you back on it may be in a couple of weeks so we can touch base because we know that the government is constantly giving us updates, and I think it's very important that we examine and we talk about it. So
Okay.
thank you so much for
It was
joining
my
me.
pleasure.
And oh, please, uh, how can your future patients find you if they're interested in going under your care?
Okay, so I have two offices. One office is in Brooklyn. They can always call for an appointment. The office number is 646 818 3128. That's a new number that I have. 646